I want you to stop for a moment. Not because something is wrong, at least I hope not, but because I want you to think about something that most people never think about until it's too late. Your feet. I know that sounds strange. You clicked on a video about blood sugar, about warning signs, about something happening quietly in your body, and I'm going to start by talking about your feet. But I promise you, by the time we're done here, you'll understand exactly why. In over 2 decades of seeing patients, sitting with them in that exam room, going through their histories, I've noticed something consistent. By the time people come to me worried about their blood sugar, about their circulation, about the way their body has been slowly and silently changing, the signs were already there, months earlier, sometimes years earlier, but right there on their feet, and nobody caught it, not always because anyone was negligent, but because we don't teach people to look there. We don't teach people to connect what they see on their feet to what's happening deep inside their blood. And that disconnect, that gap between what the body is showing and what the person is seeing, is something I've spent a long time thinking about. That's what I want to talk about today. Not to frighten you. That's not the purpose of this. I want to give you the kind of information that I wish someone had given my patients before they sat across from me looking surprised. Looking like, why didn't I notice this sooner? Why didn't anyone tell me? So, let's talk about your feet. I've been a physician for a long time. Long enough to stop being impressed by textbooks and start being impressed by patterns. The body has a way of telling you things, quietly, patiently, in ways that are very easy to dismiss. A little tingling here, some dryness there, a color change you didn't pay attention to, a shoe that doesn't fit quite the same way it did 18 months ago. Most people wave it off. I've been on my feet all day. It's just the cold. I'm getting older. Things change. And sometimes, that's all it is. I want to be honest with you about that. I'm not here to diagnose you through a screen. That's not possible, and anyone who suggests otherwise isn't being straight with you. But what I can do is share what I've observed, what I have seen repeated again and again across many years and many patients, and let you decide whether any of it sounds familiar, whether it prompts a question, whether it's worth a conversation with your own doctor. Because awareness, real awareness, the kind that makes you genuinely pay attention to your own body, that isn't fear. That's something more useful than fear. That's the beginning of actually doing something. Let me start with something that almost everyone dismisses. And I mean almost everyone, including people who consider themselves quite attentive to their health. Numbness or tingling in the feet, specifically in the toes, in the balls of the feet, sometimes spreading toward the top of the foot or up toward the ankle. A sensation that my patients have described to me in many different ways over the years. Some say it feels like wearing a thin sock that isn't actually there, or a phantom layer between their skin and the world. Others describe it as static electricity that never fully discharges, a low-grade buzzing that comes and goes, but never fully resolves. Some describe pins and needles they've come to accept as their normal, and others say their feet simply feel muffled, dulled, like something is wrong with the signal between them and the ground they're standing on. Here's what I want you to understand about that sensation. The nerves in your feet are among the longest nerve fibers in the entire human body, running from the lower spine all the way down through the legs and into the very tips of the toes. And because of that length, because of how far they travel, they are extraordinarily sensitive to changes in the blood that feeds them. A disruption that might not be noticeable elsewhere in the body can produce a clear and measurable effect at the far end of those long fibers. One of the things that affects those nerves more reliably than almost anything else is a prolonged elevation in blood sugar. When glucose stays elevated over time, not just after a heavy meal, but chronically, as a sustained pattern, it begins to damage the walls of the tiny blood vessels that supply those nerves with oxygen and nutrients. The vessels become less efficient, less able to nourish the nerve tissue that depends on them. The nerves gradually start functioning less well, less able to transmit signals cleanly, and you start to feel that degradation in the most honest way the body knows how to report it, as that strange, persistent tingling, that numbness that shouldn't be there. But what I've seen in practice, repeatedly, is this. Patients come in with that sensation, mentioning it almost as an afterthought because they've stopped taking it seriously. And when we look back at their blood work history, their fasting glucose had been quietly trending upward for a year, sometimes 2 years. They weren't diabetic. Some of them weren't even technically pre-diabetic by the strictest clinical standards at the time. But the direction was there. The pattern was building, and their feet had already started responding to it. Now, and I want to be careful about this, tingling in the feet can mean many things. A pinched nerve in the lower back, a B12 deficiency, which is more common than most people realize and is frequently overlooked. Poor circulation from an entirely different cause. Certain medications. Thyroid issues. But the list of possibilities is genuinely long, and I'd be doing you a disservice if I suggested that this one symptom, in isolation, points definitively to any single cause. But if that tingling is persistent, if it's there when you wake up in the morning, when you're sitting still with your feet flat on the floor, if it's been gradually becoming more noticeable over months rather than less, that's worth mentioning to your doctor. Not in a panicked way, just clearly, calmly, accurately. I've had tingling in my feet for a while now. I'd like to understand what's causing it. That conversation is not a small thing. The next sign tends to embarrass people, which is probably why it goes unmentioned for so long. Extremely dry, cracked skin on the feet, particularly on the heels, aren't the kind of dryness that doesn't respond to moisturizer the way it used to. Deep fissures, sometimes uncomfortable, sometimes painful, sometimes even bleeding at the edges during dry weather or after standing for long periods. I understand the instinctive response. That's just dry skin. That's winter. That's because I wear open shoes. That's because I forget to moisturize. And sometimes, genuinely, that's exactly what it is. But here's what I've learned to pay attention to. When that dryness is chronic and persistent, when it appears alongside other foot changes I'm going to describe, when it shows up specifically on the heels and outer edges of the foot, and resists all normal care over many months, that can be the skin responding to something much more specific than climate or neglect. Or the sweat glands in your feet are regulated by a branch of the autonomic nervous system, the part of your nervous system that manages things you don't consciously control. Your heart rate, your digestion, the dilation and constriction of your blood vessels. And among those automatic functions, the moisture production in your skin. When the small nerve fibers that govern those sweat glands are compromised, damaged by the same kind of prolonged metabolic stress I described, the glands stop producing adequate moisture. The skin dries out not because the air is particularly dry or because you forgot lotion, but because the regulatory signal that keeps the skin hydrated has been interrupted at the source. I've had patients who spent months trying increasingly expensive foot creams, rotating between products, and trying different application schedules. Their heels kept cracking. Nothing resolved it. And when we sat down together, and I asked them to walk me through everything they'd been noticing, the persistent dryness, yes, but also the occasional tingling they'd mentioned once, and then not brought up again, the fatigue they'd attributed to being busy, the increase in thirst they'd assumed was because they weren't drinking enough water, It painted a picture I'd seen before. Again, dry feet alone is not a diagnostic finding. It's one piece of information. But chronic, unexplained dryness that persists despite reasonable care, and that has been present for months? That piece of information belongs in a medical conversation. Changes in the appearance of the toenails. Not dramatic changes. Nothing that would make you gasp. I'm talking about nails that have become thicker than they once were. A yellowish tint that wasn't there before. Nails that seem to grow more slowly than they used to, or that have become more brittle and prone to cracking, or that have started lifting slightly from the nail bed at the edges. Changes that happened gradually enough that you adjusted to them without ever consciously registering the shift. The explanation is straightforward when you understand the anatomy. Healthy nails depend on healthy blood flow to the nail bed, the tissue that lies beneath the nail. That nail bed is rich with small capillaries, and when circulation to the extremities is compromised, those capillaries are often among the first structures to show the effects. The nail reflects the quality of the supply beneath it. Thus, when that supply is reduced or disrupted, the nail changes: texture, color, growth rate, structural integrity. Now, thickened and discolored toenails are also frequently associated with fungal infections, which are extremely common in feet and not inherently alarming. But here's the clinically interesting part. Fungal infections take hold more easily and persist more stubbornly in people whose local immune defenses are compromised. And one of the most consistent ways to compromise those local defenses is chronically elevated blood sugar. Glucose at elevated levels creates an environment where certain fungi thrive, while simultaneously impairing the cellular immune activity that would ordinarily keep those organisms under control. So regardless of whether we're talking about nail changes from reduced circulation or from a secondary fungal infection that found fertile ground because of a shifted metabolic environment, both of those threads, if you follow them, often converge at the same underlying issue. I've seen patients with nail changes they'd had for 2 or 3 years. It's just a cosmetic thing. Lots of people have thick toenails. And that was true, but it was also part of a larger picture that, once we looked at everything together, told a coherent story. I want to describe what I call the cold feet paradox, because it's one of the more confusing patterns I've encountered over the years. Some people have feet that are chronically cold, not just when temperatures drop outside. Year-round, even in a warm home, even lying in bed at night with covers over them. Ice cold. They've so thoroughly normalized this that it doesn't even register as a symptom anymore. They sleep with socks on. They keep their feet tucked under them when sitting. And when they mention it at all, it's as a personality trait rather than a physical observation. I've always had cold feet. And then there are other people who experience something that sounds like the complete opposite. A burning sensation in their feet, particularly at night. An uncomfortable heat, not warmth. A hot prickling, a crawling sensation, a feeling that the bedsheet barely touching their feet is somehow irritating or even painful. Here's what takes most people by surprise. Both of these, the chronically cold feet and the burning feet, can be different expressions of the same underlying problem. Different types of nerve fibers serve different functions. Some detect temperature. Some detect pain. Some regulate blood vessel tone and the body's ability to direct blood where it's needed. Depending on which fibers are affected first, and how severely, the outward symptom can look very different from person to person. Cold feet, in this context, often reflect reduced blood flow. Vessels have narrowed or lost their elasticity and their normal ability to dilate in response to cold or demand. The extremities, already at the far end of the circulatory system, receive less of the warm, oxygenated blood that should keep them comfortable. The burning, on the other hand, often reflects nerve irritation rather than nerve loss. The nerve is still active, still transmitting, but it's misfiring, sending pain and heat signals in response to stimuli that shouldn't produce those signals at all. The sheet touching the foot feels like something it shouldn't. The nerve is confused. Most people with chronically cold feet learn to live with it for years without questioning it. The cold is familiar. It doesn't interfere with daily life in a way they can name. It's the burning that finally brings people in. And by then, I always find myself thinking about the time before they came. I had a patient, a man in his early 50s, physically active, not significantly overweight, someone who would not have appeared high risk by any casual measure, who mentioned almost as a passing comment during a routine appointment that his feet had been burning at night for about 8 months. He was almost apologetic about it. He thought it was probably nothing. He'd been embarrassed to bring it up at earlier visits because it seemed like such a small thing. When we looked at his blood work and traced the trend, his blood sugar had been slowly rising for a considerable time. The nerve symptoms had begun well before his values would have reached a threshold that would have prompted clinical concern by most standard guidelines. We caught it, but only because he finally mentioned it. I've thought about those 8 months many times since. This one almost never comes up unless I ask directly. Changes in hair growth on the tops of the feet and the lower legs. I understand why no one volunteers this. It seems trivial at best, cosmetic at worst. But consider it physiologically for a moment. Hair follicles are living structures that require adequate blood supply. They are not passive, or they are actively maintained by the circulation that reaches them. When the blood supply to the lower extremities is being compromised, when vessels are narrowing, losing flexibility, or no longer responding normally to the body's regulatory signals, one of the early and quiet signs is that hair growth in those areas diminishes. It thins, it slows, and in some areas, it stops. This isn't the same as the general hair thinning that comes with aging, which tends to be gradual and diffuse. What I'm describing is more focal, specific to the tops of the feet and the outer lower leg, sometimes asymmetric between the 2 feet, often corresponding to the areas where circulation is most reduced. I've had patients notice this for the first time during an examination when I point to it. They look down and realize that the hair they once had on the tops of their toes simply isn't there anymore. When did it go? They genuinely cannot say. It happened in increments too small to notice individually, which is, of course, how most of these changes happen. The body communicates slowly. That's the central challenge. Each individual change seems minor. Each can be explained away on its own. It's only when you step back and look at the collection, the tingling, the dryness, the nail changes, the hair loss, the temperature changes, that the pattern becomes visible. And the pattern, in medicine, is often more important than any single finding. I want to briefly address swelling, because there's a version of swollen feet that deserves more attention than it typically gets. Most people experience puffy feet periodically, a long day standing, a long flight, excess sodium. The swelling responds to elevation, resolves overnight. That's normal physiology. What's different is swelling that persists through the morning. That's still present when you've been lying still all night. That leaves an indentation when you press your finger into it, what we call pitting edema. And that has been gradually progressing over weeks or months, rather than coming and going with daily activity. I want to be clear. Persistent swelling in the feet has many possible causes, some of them entirely unrelated to blood sugar. Heart function, kidney function, vein health, all of these can produce lower extremity swelling, and all of them need to be properly investigated and ruled out. I'm not making a single cause argument here. But the kidneys are among the organs most sensitive to the long-term effects of chronically elevated blood sugar. and long before kidney disease is established, long before numbers on standard blood work reach concerning thresholds, subtle changes in how the kidneys manage fluid can begin to manifest. Progressive lower extremity swelling is sometimes the first visible sign of that shift. If that kind of persistent swelling sounds familiar, if it's been present for a while, and you've been attributing it to something vague and haven't had it formally evaluated, I'd encourage you to make that appointment. Let me step back from the individual symptoms and say something about what all of this means together. The feet are, in a very real physiological sense, the canary in the coal mine, or the nerve fibers reaching the toes are the longest in the body. The blood vessels supplying the feet are among the smallest and most distal. The feet are the last stop in the circulatory and neurological system, the furthest from the heart, the most dependent on everything in between functioning properly. When the body is under sustained metabolic strain, the feet are where consequences tend to appear first. Not always, not in every person, but consistently enough that a physician who knows what they're looking at can learn a great deal from a careful examination of the feet. The pattern I've seen too many times is people living with these changes, separately, over years, never connecting them to each other, never understanding them as a coherent signal, treating them as individual nuisances, and while they're dismissed one by one, the underlying process continues. The body is not sending nuisances, it is sending information. What we do with that information is our choice. I want to say something that I mean genuinely. You are not helpless here. The metabolic processes I've been describing, gradual elevation of blood sugar, early vascular changes, beginning nerve vulnerability, these are not fixed outcomes for most people. Particularly when patterns are identified before established disease has taken hold, meaningful change is possible. I've watched it happen. Consistent daily movement, a genuine reduction in refined sugars and processed carbohydrates, adequate, consistent sleep, something whose effect on blood sugar regulation is dramatically underappreciated, and addressing chronic stress, which raises cortisol, which directly elevates blood sugar in ways that accumulate over time. None of these are radical. None require extreme measures. But all of them require commitment, and commitment requires a reason. I hope today has given you one. The most practical thing I can offer you is simple. Look at your feet. Take your socks off and really look. Both feet, the skin on the heels, the tops of the toes, the spaces in between, the nails. Press gently across different areas and notice whether the sensation is symmetric, whether the left foot feels the same as the right. Notice whether there are areas that feel different from what you'd expect. And if you have a primary care doctor, ask them to include your feet in your next visit. Ask for a brief assessment of circulation and sensation. It's not invasive. It takes a few minutes. And it can surface things that a conversation alone cannot. If you have risk factors, family history of diabetes, extra weight around the midsection, high blood pressure, or a history of being told your blood sugar is a little high, but we'll keep watching. This conversation with your doctor is not optional. It's something you should be having regularly. We'll keep watching is not a reason to stop paying attention yourself. Medicine is very good at treating disease once it's established. What it has historically been less good at is the earlier conversation, the one that happens while the body is still sending early signals, while the patterns are just forming, while the options are still broad, and the window is still open. This has been that earlier conversation. Your feet may be carrying information that deserves to be heard. Not necessarily about a crisis, not necessarily about anything irreversible, but about the direction things are moving, and whether that direction is worth changing. I hope you leave today not with fear, but with attentiveness, the kind that lets you walk into a doctor's office and say, "I've been noticing some things. I'd like to understand them." Early enough that understanding leads to action, and action leads somewhere better than where the pattern was heading. That's what I hope for everyone watching. One last thing, and I want to be straightforward about this. Everything I've shared today is educational. It is not a substitute for professional medical evaluation, and I mean that seriously, not as a legal formality. Your body is individual, yet your history is specific. The meaning of any symptom depends on the full context of who you are, your age, your other conditions, your medications, your family history, everything. None of that can be assessed through a video. If something I described today resonated with you, if you found yourself thinking, "That sounds familiar," more than once, please see your doctor. Not because I've told you something is wrong. I genuinely don't know that. But because you've started paying attention, and a physician is the right person to help you figure out what that attention is finding. Take care of yourselves, and take care of your feet.